Welcome to the office. Welcome back, Ethan.
Thank you.
It's been a minute, right?
Yeah, it's been a while.
So I wanted to share a little bit with Ethan. Ethan started with me a few years back.
A while back, yeah.
A while back, right?
Yeah.
Actually, a few years.
Like 3-4 years.
3-4 years ago. What'd you come for?
Couldn't
What
put
did
my
you think?
socks.
What did you think you came for?
Oh, you're told so many different things. I thought I had pinched nerve.
Okay.
It was.
Sciatica, or just a pinched nerve?
Just couldn't.
So you couldn't what? You couldn't.
Couldn't put on my socks. Like go like this. Put on my socks. Couldn't
Because of what? Because of pain?
back. Yeah, back pain.
Back pain.
Low back.
Left side.
Yeah.
Okay. And Ethan plays soccer. He's got some skills. Okay. In college?
Yeah.
You still playing college?
Yeah.
All right. And one thing I wanted to share about Ethan, I actually learned a lot with your case, jokes aside. And I learned a lot about soccer injuries because he's a competitive soccer player. And he would have these, first it was getting rid of this pinched nerve.
Right.
And we fixed that up for
Yeah.
him, right?
Yeah.
But then it was like you're playing soccer and you're practicing and you're getting injuries.
Right.
And then you're not able to practice, you're not able to work out, and you're going through this cycle up and down.
Exactly. Yeah.
And then, but the cool part was I started watching him and watching, how soccer players move, how they kick, and learning about the different types of kicks. And through that, learned on how to fix these soccer injuries. That was actually really cool. And then I had some big soccer player come in after that, and I was able, he had the same thing you had.
Yeah.
And I didn't actually, it was a pretty big guy. They won a championship.
Yeah.
Which
Big
is
one.
kind of cool. They won a big championship. But jokes aside, I learned how to help that guy through Ethan. So thank you.
No, thank you.
Seriously, no, it was a
cool.
great learning experience,
Yeah.
and I got to use that knowledge, and learning the mechanics. I think every sport has different mechanics of the body, right?
For sure. Yeah.
So even the way you guys practice.
Yeah.
Okay, so why are you here today?
Tune-up.
Tune-up time?
Tune-up, yeah.
So nothing specific, or is there something specific
No,
today?
nothing specific.
So-
Just the ankle probably is like what we've been working on.
Okay.
Most recently, but
And we had a sprained ankle,
yeah,
Yeah.
sprained ankle.
and we were able to help with that as well.
Mm-hmm. Yeah.
And the good thing that Ethan learned being here is the sooner that we get to the sprained ankle, the faster it heals,
100%. Yeah.
right?
If you wait on it, it's just you can't get the swelling out, and then you don't adjust the joint, and I feel like it gets a lot worse if you don't. Come
And you've
soon.
had sprained ankles before.
Yeah, that healed a lot slower
Right.
if you don't come in and get adjusted. I think.
Well, yes. So one of my mentors, who was the Gonstead extremity specialist, he taught us the golden hour. And if we can get to that injury in the first hour, and as long as there's no goose egg deformity, there's no vascular, there's nothing severed, there's no blood compromise, then the faster we can get to that, the faster, 50% healing. And even with a sprained ankle or any extremity injury in soccer or any sport, I always think, because the way I was trained and taught is spine first, right?
Mm-hmm.
And the question is why spine first? And the reason why is we got to make sure, like if you sprain an ankle, you twisted it, but it's all connected.
Yeah.
Right? And 9 times out of 10 when they sprain an ankle or a knee or something, or shoulder, elbow, wrist, like falling on an outstretched hand.
Right.
And the shoulder hurts. And so, again, it doesn't make, to me, it's get the power on first, then follow kinetic chain. Get the power on first, then follow kinetic chain. Makes sense, right?
100%.
Okay, you ready to get started?
Let's do it.
Let's do it. All right, how did you do with our last adjustment, last visit?
Good. That was the fastest I've ever healed from an ankle roll like that.
So you came, how long after you sprained the ankle?
I think we waited 5 days because of the swelling. 5 days, it was less than a week, I'm pretty sure.
Okay.
The next week, I was already,
You were back practicing?
I was jumping and running, like,
Sweet.
it was crazy.
Sit back for me, please. You beefed up too, dude. some.
So
How's practice? When the game starts?
I injured it in the game 2 weeks ago, just with a summer team, though, not the college team.
Got it. Okay.
So we're playing right now.
Right on, dude. Starting at the base of the neck. Yeah, it was funny. Did you ever see the guy when he came here?
No.
You never ran into him.
I wish I would. That'd have been crazy. Watched him.
Shasha did. Shasha got a picture with him.
Really?
Yeah. Maybe Shasha will share the picture one day.
That'd be super cool.
Starting at the base. C2. A bunch of kids in the hallway that go to the dentist over there would see him. Can I take a picture, Kennedy? And he was cool about it. He was a good guy. Really nice guy.
That's cool.
Really nice guy. All right, we got C2 left. Mid back is clear. Family's good?
Yeah, good. Mom needs to come in now. She's a little stubborn.
She fighting.
Yeah, I told her, come on, just come in. What are you waiting for?
Right. All right. So you're graduating soon or what?
Yeah, I already did.
So what's the plan now?
Right now I have like another year left I want to play. So
Okay.
I'm transferring and going to do my master's.
Good for you.
Yeah.
In what?
Business.
Sweet.
Yeah.
So good news. Your spine is clear down low. We're going to check the hip. We know we need to work on the hip. And C2. Those are your two spots, and then we're going to deal with the ankle. Feet together, open and close the knees. Right side only. When he does the right, there's a slight shift of the left. Left side only. Kind of both. Let's feel it this way. They're both a little bit stuck. Put a little more curve in the back, please. There you go. Come back towards me. Top of the joint. Middle of the joint, we're at the SI joint, and the bottom of the joint. Not too bad, right?
No.
Top of the joint, middle, that's it. That's not moving right there.
Yeah.
Right SI joint is an ASI and ilium, and let's check C2 up top. Sit back here for me, please. Sweet. Now, what's interesting on his x-ray, we are working on his pelvis because there is the ASIN on the right. There is a dropped femur, which we're dealing with. It is getting better. We'll probably take a new film end of the year or something to see where it's at. We don't need to deal with that right now. And C2, if his curve, you still have a little bit of that reverse curve. Mm-hmm. And we typically don't adjust into a reverse curve. The exception is C2, or if there's a open wedge on the AP film, right there. Bend to the left, bend to the right. I'm pushing even harder on the right. So C2, right pelvis, then we deal with the ankle. Sound good?
Sounds great.
Okay, let's do C2 first. Cool. C2, nice and easy. And see how he's kind of sitting, relaxed, palms up, resting on the thighs. You can bring your knees slightly closer together and on your heels. This is your ideal. Dr. Gonstead found this to be the most relaxing position for the cervical adjustment. Why you wear a gown? People be asking that too, dude.
Me?
Yeah, why do patients wear gowns here? Everyone wears a gown.
Just want me to walk in my hoodie and my t-shirt.
So I'm going to think about the reason we do gowns. I just want to speak real quick. Okay?
Go ahead.
The reason we're using gowns, we want to evaluate the spine. We want to run the meter. We want to visualize, statically palpate, motion palpate. And the more stuff you have, more barriers you have, the more chance of misinformation you get. Okay? And you can even slip and not be on the right segment. Nice and easy, good. There we go. There it is. C2.
Oh.
That's the home. Walk it up. You like?
That one, that's the one that makes you feel like you just woke up again. You gotta do that a couple times.
Nice. Walk one more time, please. Good morning.
Russian blood.
Left side down. And C2 is pretty powerful, upper cervical, right? It actually does affect the eyes because there's a direct connection from the optic nerve besides all the other connections. So people will say, oh my God, my eyes woke up. Right?
Yeah.
Okay, ASI and ilium. And for the ASI and ilium, from the PSIS, roll a little bit forward, please. From the PSIS, the dimple, you're going 2 inches lateral, 3 inches inferior. That's the Gonstead spot. Look, it's already gone. Now, let's roll him slowly. And the set is going to be down the shaft of the femur and slight counterclockwise torque. Just like that, baby. Walk it up one more time. Don't ficker.
Yeah, that wasn't a crack.
What
That
was
a
it?
set. That was a set.
Nice.
Ooh. That feels different.
Walk one more time, please.
Okay.
Okay, let's go on your back and let's check out the ankle. So, quick scan, quick eval, feet together, bring the toes back as far as you can.
Even?
Which one did you sprain again?
This one?
Dude, look, bring them back. Your left actually goes further back than your, I gotta work on your right one today. That's actually pretty cool. We're gonna work on that, but we're gonna also set your right one. Let's do this one first. All right, let's work it out and make sure.
Doesn't feel great, but see those people sometimes.
Making the noise.
Hard.
I mean, I go to their tolerance, right? And I know it's not comfortable. People have different pain thresholds.
Yeah, it's not that bad.
There you go. Okay, let's set it. Ready?
Yep.
Go. AS talus, medial tilt. Slide up. And just put your hand there on the chair, like you did right there. Just put your hand like that.
Yeah.
Up higher. Hold. Yeah, just in case. And the right side. We'll do the board. Most of it's gone, dude.
Yeah. Oh.
I told you it was the right one that
Yeah, what the heck? That one fell on five or more, but.
Slide up. Raise your left leg.
Definitely had less motion. Like you said, like range, I think. The right one?
I think you were compensating a little bit on it since
Yeah.
that was off a little. Now let's recheck. Feet together, bring them back. There you go. Sit up and turn. Let's rescope you, make sure everything is clear. Then I'll have your walk. Sweet. C2 is clear. All right, let's motion the back. Oh wait, you wanted me to do the whole spine, right? Okay. Oh. Done it. Still clear. Cool. Now let's set the shoulders. Over, around, over, around, down.
Oh,
Sorry.
no, I got it.
There you go. Ears. Check the hands, stand up. Questions? Good.
All good.
Sweet. Comments?
If you're thinking about coming, do it.
Oh, dude, we're not plugging it.
Oh,
There you go. Squeeze. The take-home message, really, right? Like I said, I learned a lot through working with you. but also is you get it now. Whether you're in pain or not, you know you're a competitive soccer player.
Right.
And you know things, you may not have pain,
Yeah.
but things get out of balance.
Yeah.
And the idea is to get back in balance,
Yeah.
right?
Before many things compensate, I feel like, you know?
Prevention.
If you wait, yeah.
Prevention. It
It's more
takes
stuff.
longer when you're hurting.
Yeah, more stuff gets out of whack.
Yeah. All right, brother.
Thank you so much.
Appreciate you. Okay.